Welcome to the Cinnaire MSHDA 2020 Virtual Asset Management Conference. Thank you for your interest in our virtual sessions. We hope you enjoy our session on staff and resident safety.
Hi, everyone. This is Matt Gatewood, Vice President of Lockwood Property Management Group. With me today are Denise Lanfear, Vice President of Human Resources, and Jennifer Staniszewski, Regional Property Manager. We're glad to be here today at the 2020 MSHDA Cinnaire Virtual Asset Management Conference, presenting a topic related to staff and resident safety. We'll begin by discussing coronavirus and COVID-19 response and preparedness planning and best practices for multifamily communities. We'll also present strategies for protecting staff members and residents, along with contractors, trade partners, and visitors. Finally, we will explore the operational changes necessary to help ensure a safe and healthy community for all. The outline of the session will start with a discussion on the prevention of spread of COVID-19. We'll review CDC and state of Michigan guidelines related to screening tools, temperature scans, masking requirements, social distancing, sanitizing for staff members, visitors, prospects, residents, and trade partners. Next, we will discuss recommendations for dealing with confirmed COVID-19 cases with staff members and residents. We will discuss quarantine protocols related to CDC and County Health Department requirements, cleaning and disinfecting, maintenance services, and return to work policies. And lastly, we will look at changes to operational models in terms of staffing levels and schedules, hours of operation, office space considerations, resident and visitor access, resident paperwork processing, office and workspace modifications related to plexiglass barriers, etc., and common areas and amenities such as lobbies, elevators, fitness centers, and swimming pools. We'll also discuss maintenance service and turnover related to social distancing within apartment units, as well as apartment sanitizing, certified clean apartments, MSHDA inspections, as well as overall compliance. So, with that said, let's go to the top. And again, I would encourage anyone, if you have a question or anything to interject, a comment, please do so by raising your hand, and Denise will identify you, and we can kind of knock off questions and comments kind of on the fly. So let's talk about where we are today. All of us are aware that the world has changed quite a bit since March of this year, and it's frankly, I think for many of us, it's been a pretty brief and frenetic 6-7 months. And that said, the world has changed quite a bit as it relates to how we do business, how we relate with our residents and staff members, trade partners, and municipalities, as well as MSHDA and others. The CDC and state of Michigan have issued various guidelines over the course of the previous months, effectively telling us how we need to protect one another, protect the business, as well as how to operate within these new, kind of this new norm. And within that, a lot of new tools have become available, a lot of things that we've never done before. I don't think any of us necessarily, when we would go to the grocery store or visit an apartment community, would think about putting a mask on first, or a pair of gloves, or carry a bottle of sanitizer in your pocket or whatnot, but all those things now have become very normal. So within the guidance that's been provided to each of us, and each company has handled these things differently, within the guidance provided by the CDC and the state, we've effectively, here at Lockwood Management, have effectively put together a response and preparedness plan to deal with both preventing the spread, dealing with positive cases, as well as how do we operate our communities successfully in light of all these new restrictions, requirements, and constraints that we've inherited. So one of the things that I think many of us are doing relates to screening tools. Initially at our company, we looked at various screening tool options to provide to our staff members prior to starting their workday, as well as the potential visitors who may be visiting our communities. And we settled on a paper-based screening tool, which is effectively a questionnaire asking various questions. Since then, we've migrated to a electronic phone-based solution that Denise, maybe you could speak a little bit to more specifically.
Sure, yes. So every single employee in our company, we registered with their mobile phone text. And what happens is Monday through Friday or whatever their work schedule is, they receive a text from with a questionnaire attached, and it asks the basic employee screening questions about if an employee has been exposed to COVID, if an employee has any of the symptoms that the CDC recommends us asking, cough, fever, etc. And then it asks the employee if they're taking any Tylenol, Advil to suppress a fever. Depending on the answers, if they answer no to everything, the employee gets a green QR code, which shows that they are clear for work. They have to show their manager that upon entering into the community. If they answer yes to one of the questions about having maybe a symptom, it will be yellow, and it indicates that they need to call HR before they're allowed to go into work. If they answer yes to a question that they've had direct exposure with someone with COVID-19, it gives them a red QR code and says that they are not clear for work. Then they also have to call human resources. So the tool is very simple. It texts the employee directly, and all data comes directly to me, and HR is the HIPAA officer, and I can quickly see through a dashboard who was clear or not clear for work and send messages through the app to them. So again, it from an audit perspective, it tells me every single employee that was supposed to work did do their screening tool. And then it makes it simple for managers to just look at a green, yellow, or red QR code on whether or not they can report to work versus going through paper questionnaires and trying to figure it out on their own, whether or not they should come into work. That's our newest technology, and we just implemented it last week, but it seems to be working well.
That's great. Thanks, Denise. And what we like about this tool is it allows the staff member to fill out the tool while still at home before they leave to head to work. And it effectively allows them to, plan accordingly, gives them enough time to report to their supervisor through the screening tool that they may not be coming in that day. We are also looking at rolling this tool out to visitors and trade partners as well, and we're in the throes of doing that. Now, keep in mind, I think like many of you, we initially, if we step back to March, we initially closed all of our offices to visitors, and for a very short amount of time, we closed most functions throughout many of our communities. And through the guidance of the governor's office, we followed the essential worker protocol that was issued, and we had a kind of a skeleton team of essential workers at each of our communities for a number of weeks before we finally started to bring folks back full time into the early summer months. So it was critical that we had this screening tool in place at that time in order to make sure that even those few essential workers that were on the job were feeling safe. We were providing them with some reassurance that we were looking after them and looking after their coworkers. And I think this screening tool that we've implemented is fairly robust, and it has some additional capabilities which we'll look to roll out later. Along with screening tools, I think we've all had our temperature read at some point going in and out of some location. Maybe it's a community, a corporate office, an airport, or other locations. But we are also doing temperature scans at some of our communities, and we are looking at more robust pedestal and table-mounted touchless temperature scanning products that are in the market. We have yet to roll those out, so we are doing temp scans in many of our senior living communities manually at this point. As it relates to masking requirements, we know throughout the course of the last few months, those requirements have changed, modified, come and gone, different opinions here and there relative to what we should be doing. But I think everybody has settled on the fact that masks are required in most every place of business, including residential communities, such as the ones that we operate. And we require those masks of all of our staff members if they cannot abide by social distancing protocols of 6 feet. If they are working closer than that, we require a mask, even if it's within an office environment. And we also require all, as per the governor's dictation, we have begun requiring, it's been probably a month or more now, requiring masks of all visitors who may come into our offices. So I think that, masking requirements, masking cleanliness, disposal of masks, I think those things are all very important relative to having an effective masking program. The last thing we want to see is masks disposed of on the walkway at nearing the entrance of one of our communities. So we want to make sure that we have proper disposal protocols in place for disposing of masks. We do not require gloves of any of our staff members. However, there are maintenance technicians who have requested and have shown an interest in gloving up to run service. So we certainly have not discouraged the use of gloves, but we do not require it within our communities. And again, there's a proper way to put on and take off gloves similar to masks. We want to make sure that if we are having staff members that are gloving up, they are taking off those gloves and disposing of them in a proper manner. We are more, we've spent a little more time encouraging proper hand washing and more robust hand washing to make sure that all of our bathrooms are equipped with the proper hand sanitizers and soaps so that we can encourage our staff members, especially in our senior living communities, in dining services, to make sure that they're washing their hands frequently. In general terms, we also are following sanitizing protocols. Every day, each of our communities, common areas, especially in our senior living environments, we are deep sanitizing those spaces before the start of each business day to make sure that the spaces are safe for our staff members and any visitors that may be entering the community, as well as sanitizing kind of post-visit, if you will. And certainly we have a more robust sanitizing protocol as it relates to confirmed cases within a community. Any questions on preventing the spread related to screening tools, temperature scans, masking, social distancing, sanitizing, or even things that you may feel are relevant to share that you may be doing at some of your communities?
Hi, this is Vera. I'm actually with KMG Prestige, and I did have a question. We are currently on phase 2 for a lot of my properties due to the areas where they're located. Is that, are you guys all of on site, in phase 2, or are you on a different phase of the actual returning back to normal?
Most of our communities are in phase 4. Some are in phase 3, but most are in phase 4. We don't have, and Jennifer, maybe you can jump in here. We don't have any that are phase 5, I don't believe, in our portfolio.
No.
No, okay. Yeah, so we're primarily phase 3 and 4 at our communities. And again, we, along those lines, and we'll touch on it when we speak relative to the operational changes that we've made. Those spaces, those offices that we do have reopened, we have reopened in a very limited manner as it relates to visitors and trades and whatnot.
And Amy has a question, Amy Ward.
Yes, I do. Thank you. I was curious how many employees you have with the use of your app.
We have 205 right now.
Okay. And is there a limitation with the app, the number of employees?
No, there's no limit on the employees, and we can also roll it out to as many visitors as we want as well, and contractors. So there's no limit.
Okay. My next question is in regards to the documentation of the sanitation that you're doing. How are you documenting what you're doing?
I'm going to let Jen speak to that. I think she can speak to that one. Jennifer?
So in every common area that is in the communities or in a multi-apartment, they are documenting when they log and clean that in, and it's visible for any visitor or employee to see when that's done. And then they take that by the end of the month, and then we put it in like a binder so we can show proof that that was sanitized, and then we start it all over again.
Okay, great. Thank you very much.
Yeah, so we keep daily sanitizing logs at each of our communities, as Jen mentioned. Those are logged. We can ultimately upload that data into an Excel doc, and if we needed to present it to anybody, but ultimately it's housed locally at each site in a binder that can be inspected, and it is visible on a daily basis at a desk, at the entrance of the community, so that visitors and staff members can see when the community was last sanitized.
Scott Belts has a question.
Yeah, what's the name of the app that you use?
It's through M Health Coach.
Thank you.
You're welcome.
All right, good questions. Appreciate that. And if you have any others that you think of along the way, just don't hesitate to raise your hand. Let's move along to the next area of discussion, which is dealing with confirmed cases within your community. And I'm sure, unfortunately, some of us have had confirmed cases, some have not. For most, it's kind of a combination related to the severity of cases. Some have, I'm sure, had staff members as well as residents who've had confirmed cases. So obviously it's critical to follow CDC and health department guidelines, state of Michigan guidelines, as it relates to the reporting, the follow-up, the quarantine, the sanitizing, notification, all those things as it relates to positive cases. So obviously we've got a HIPAA concern that would apply to anyone who we may be notified of a positive test result. So we need to be mindful of that. But spelled out in the response and preparedness plan would be or should be your protocol for dealing with confirmed cases. So that would be initially reaching out, depending on the type of environment it is, reaching out to staff members to make sure that they understand that we've received notification of a positive test or a positive test result. Within a building, within an area, you could identify apartment. We don't necessarily want to speak directly to resident names and personal information, but obviously as an employee or a staff member, they're likely to know that information already. We would not ever disclose that type of information to another resident. We would not want to distribute a letter, let's say, or notify or paper doors to say, oh, FYI, just want to let you know that Mr. Jones in apartment 1F across the hall from you has tested positive. That would be a violation of that individual's HIPAA rights. We do, however, notify the community that we have received notification of a positive test result within the community. Denise, can you speak a little more to that as it relates to HIPAA?
Sure, from the employee side as well, with HIPAA, you have to make sure that even if you have an employee that tests positive for COVID, you cannot give that employee's name out to anybody. You need to find out who that employee had close contact with, and you can notify the staff that there's someone who tested positive for COVID that they may have had exposure to. Obviously, sometimes everyone knows who it would be, but you have to be careful not to spread that information. You have to have your employee work through the health department or the CDC with their requirements for notification of exposure, but you have to be careful as a company to not give that information out because it is private protected health information.
Got it. Thank you. So after that, the next step from our response and preparedness plan would be to notify the county health department in the county within which your community is located, and then get guidance from them as it relates to, like Denise said, contact tracing and other measures that they may want to see put into place. So we want to make sure that we get guidance from the health department. And as I'm sure many of you know, most of the county health departments are keeping lists for tracing purposes to make sure that they understand the numbers and understand and try to manage the spread the best they can. And then we typically, depending on the location of the spread or of the confirmed case, in other words, if we have a garden style community with no community building, and the community building has limited access, and we know that the resident, the building, let's say, has exterior entry points with no common corridor, and we know the residents likely went directly from outside the community to their apartment, and there's been no exposure within common areas or interior areas that others may come in contact with, we'll focus our sanitizing and disinfecting efforts on those areas. Likewise, if it's in a senior living community, let's say, that has lots of common areas, elevators, multi-floors, and other areas where a resident may have visited prior to their being notified of their positive case, we will make sure that we sanitize and disinfect all of those areas. And we do that sanitizing protocol of a positive COVID test, we do not do internally with our staff members like we do our normal daily sanitizing. That we farm out to someone like a Belfour and others to actually do a professional sanitizing, deep sanitizing, with an acknowledgement from that company that the spaces were satisfactorily sanitized. And we do that as soon as we're able, post notification of the positive case. Additionally, as Denise could, I think, speak to as it relates to staff member cases, we would immediately, if we were notified of a positive case and that staff member were on the clock, so to speak, or on the job, we would immediately send that person home and follow additional protocols. And Denise, could you speak to that?
Yep, sure. So when we have had an employee test positive for COVID, we do send everybody home. And then we have the office professionally sanitized or any areas where that person had worked. In some of our communities, we have employees completely separated in other areas so that they're not all in the same office, maybe working out of different areas. But yes, if someone tests positive, we bring in outside company to do sanitation, and we send all the employees home, have them contact the health department or CDC to find out what the protocol is for exposure. We can't require those employees to go get a COVID test, but I strongly encourage them to do what would feel more comfortable for them. And then, as you guys know from that screening tool, they would technically have been exposed to someone with COVID, which would cause them to stay home for the recommended amount of time, which is around 72 hours. Or if they have symptoms, then that's a whole nother protocol of how long they have to quarantine. But if an employee does test positive for COVID, we send the whole office staff home, sanitize, and then bring them back depending on their exposure.
Thanks, Denise. And that, as it relates to resident exposures, again, we would typically be notified by a family member or relative. It may be the actual resident themselves. Typically, they're self-isolating within their apartments at that time. Unfortunately, there have been cases where those residents are in hospital. And so we would respond accordingly. If they are quarantining in place within their unit, that does not give us the opportunity to enter that apartment safely in quarantine. So we would have to wait till they were past that quarantine period, self-isolation period, and then we would enter the unit and have a third party professionally sanitize that unit. As it relates to maintenance services with a confirmed case, again, very similar. We would not enter, and this follows the MSHDA guidelines as well, I believe, as it relates to unit inspections. We would not have any staff member enter an apartment where we had a known case of positive test result for COVID-19. Additionally, our standard protocol is post move out, even if we don't have a positive case, post move out, we leave apartments closed for 72 hours after move out before our turnover staff enters a unit to clean and prepare the unit for the next resident. So we have built in an additional, and it's a little painful for us relative to the financial side of the picture, but we've built in 3 additional days to our turnover time to make sure that we are guarding against the potential of an unreported case that may have existed within a residence unit. And as Denise mentioned, return to work policies as it relates to a positive case of a staff member, we looked into initially requiring, should we require evidence of a negative test result, or should we require some sort of doctor's note stating, that the staff member is in the clear and can return to work? And Denise, can you speak to that one a little bit?
Sure. So we had contacted an attorney, and the attorney had let us know that we cannot make it a requirement for employees to take tests. We had thought about originally, what if we have every single employee take COVID test every week before they came in, show that it's negative, and everyone will feel safe. You can't require the employees to take COVID tests, and then you could take a COVID test and then go to the grocery store after or wherever and be exposed to it. So it wasn't very, we figured it wasn't really reliable because the COVID test would just be at that time. If an employee does go out for COVID, and knock on wood, we've had very few, there are very specific guidelines that employees do have to follow. So just make sure you have those written out in your return to work policy, and that you talk to the employees about what those mean. There's 14 days from the first onset of a symptom. Plus, you have to make sure they go 72 hours without any symptoms, and that has to be without the use of any medication. So minimum would be 14 days from exposure, and maximum could be, further longer, depending on how long their symptoms lasted.
Super. Thank you, Janice. So with all that, and again, I think we've covered a lot in that section, and there's certainly a lot more we could talk about, and there's probably a few hours worth of discussion that we could fold in around this topic. But are there any questions or comments that any of you had, or experiences that perhaps you've had within any of your communities that you'd like to share? Just goes to show you how thorough that section really was. All right. Okay, well, let's move on to the next. And again, like always, if you think of something kind of after the topic, no such thing as a bad time to ask a question or raise an issue. So we can always come back to it. So based on all of those things, so the fact that we're opening offices to some degree, we're restricting access to some degree. We've been closed for a long amount of time. We've maybe had displaced staff members who've come back. Now we're trying to operate with some semblance of normalcy. The common theme that's taken place over the past 6 or 8 months, I guess it's not 8 months quite yet, but 6 months certainly, is that the one thing that hasn't changed is our residents. Residents haven't moved out. Unfortunately, some residents may have been afflicted with the virus, but that part of the business for most of us has not changed. We still have residents living in our communities. We still have residents needing to pay rent. We still have residents needing maintenance services. There's emergencies that happen. In some cases, there are, issues that require staff attention. So all those things basically stayed the same from the residents' perspective. If they've got a service issue or an issue within their apartment, all they know is historically they picked up the phone and someone answered it and they put a service request in and someone showed up to fix it. And so those things we've obviously had to modify and tweak a little bit relative to our operational models within our communities. So obviously staffing levels and schedules have changed. Like I had mentioned with us, initially we had gone to a real skeleton crew of essential workers only. And in our case, that was one property manager and one maintenance person, typically a maintenance supervisor at each of our communities. And from there, we built staff up as situations changed and as we moved forward throughout the summer. And now we're largely staffed up, fully staffed up in most of our communities. But we've done a lot with scheduling. We've done a lot to accommodate resident needs, paperwork needs, compliance needs, all the various issues and the safety of the residents and staff members. We've done a lot of flexible scheduling and shuffling workloads and whatnot to make sure that we can manage the best we possibly can as it relates to the requirements that our residents have. As well as our needs as they relate to MORs and REACTs and capital needs assessments and inspections in general. We've had to do a lot of flexing of time to make sure that we had proper staffing to both keep people safe as well as deal with all the issues that we may encounter on any given day. Hours of operation have changed in many of our communities. We're in some cases working a little bit longer day. Because it's a little more convenient, especially related to restrictions. We have restricted visitor volume at most of our communities. We have restricted visitors to a maximum of 2 at a time, and we typically have our offices locked to entrance. And effectively, we're doing appointment-based visitation, or you basically need to ring the doorbell and we'll come and let you in, and no more than 2 at a time. And due to that, it's necessitated us changing some of our hours of operation to help accommodate as many people as we possibly can. We've also had to reconfigure office spaces, right? So we've, like many of you, I'm sure, have reconfigured tables and desks and moved people apart and closed off different rooms, and things like fitness centers and swimming pools and gathering places and general common area spaces have typically been closed down. As we've returned visitation to most of our communities, we've reopened some of those spaces, but they've been completely reconfigured, decontented. We've removed touch points and things that can be touched and set back on the shelf, like books and magazines and leave behind and collateral and all that kind of stuff, so that we're trying to keep people as safe as possible. We've also done a lot with accommodating resident paperwork needs relative to recertifications and other issues that require resident paperwork, resident signatures, all those kind of things, where we would typically have the resident just come to the office and drop things off or sign documents. We've done those things as touchless as possible. We've done a lot of hand delivering of paperwork to resident apartments, and then kind of done an exchange of paperwork, if you will, without being face to face. So we've had to become fairly creative in some of those areas. We've also installed a lot of plexiglass barriers at a lot of our office spaces on individual desks, just to separate staff members from those few residents who may be coming in, as well as from vendors and trade partners, and typically would be an emergency basis only. In our senior living communities, we have third-party med care providers that are providing ADL support and other medical-related support. So obviously, keeping barriers in place between us and them is always a good thing. And then, depending on the size and layout and architectural design of any given community, we have issues related to lobbies and elevators, and like I mentioned earlier, fitness centers and swimming pools, relative to how do we operate those. What about an elevator? That we think that most of us, many of us I should say, get on elevators every day, whether it's to come to work or to visit someone or when we travel and whatnot, and you don't think anything of it, right? Of pushing the buttons and like Elf and pushing every button on the control panel, and you don't think anything of that historically, but now we do. And so we want to make sure that as much as possible, certainly as it relates to resident use, we're trying to manage the use of some of those spaces. Obviously, sanitizing and disinfecting protocols are critical. But Jen, can you speak a little bit to that as it relates to what you're doing in your communities relative to just general common area spaces and kind of managing those contacts?
So every day we're doing the common area spaces, but if somebody's moving in, we lock down those elevators and we put signage up. And then after they have moved in, we're disinfecting those elevators in the areas that they're coming in. We also do temperature checks for anybody that's coming in for a move in. Same thing for a move out.
Yeah, so again, we are much more involved in the management of move-ins and move-outs relative to exchange of documents, exchange of keys, both on the move-in and the move-out side of the equation. Much more management than we have historically had in those processes, but we've been successful in, and again, we just started allowing move-ins and move-outs over the last 2-3 months. Initially, we had kind of locked all those things down as well, but we've been successful in returning to some of those normal processes with a bit of a twist as it relates to sanitizing and cleanliness and whatnot. And then obviously, I think most of us certainly have ongoing experience with maintenance service and turnover. I mentioned what we do, which is to leave apartments vacant 72 hours post move out, just to make sure that we're not putting one of our staff members in an environment that may be unhealthy as much as possible. But when there is service to be run in an apartment that's occupied, we either schedule that service in advance with the resident on an appointment only basis and request that they be out of the apartment when our technician is in the apartment. And if they're unable to do so, we ask that they isolate themselves within a different room so the technician and the resident are as separated as possible. And as always, our technician would be masked up, would exercise proper social distancing, and would sanitize all the spaces kind of on the fly that he or she touched as they vacated the apartment. And one of the things that we do, and we've modeled this after the hospitality industry, is we are providing certified clean apartments at turnover. So every time a unit is turned and sanitized, deep sanitized, the last person who walks out of that apartment, which would be the maintenance technician or perhaps the property manager upon doing a turnover inspection, the last person who leaves that apartment applies a certified clean sticker over the door jamb, between the door and the jamb, that basically has a date on it and the initials of the person who is certifying that that apartment has been cleaned. And that's really, our way of telling our new move-ins, as well as the current residents, that we take this seriously. We take resident and staff health and safety very seriously, and we're providing the cleanest apartment that we can provide them for their new move-in. And it goes a long way as far as a sales tool relative to being able to tell our residents that we have certified clean apartments for them to move into. Any questions about any of that stuff, or comments, or share what you're doing, even though I know it's super secret? Let's share it.
We do have a question. Kate Benson.
And my question is, you're having your maintenance people do the sanitizing. Have they been trained for that? Because it would need to be, I'm assuming, a different sanitizing than just going in and making the unit ready.
That's a good question. So correct, we have implemented some, call it more retraining and focused, it's really guidance based on what the CDC has presented. It's not so much hands-on as far as here's how you wipe this or here's how you wipe that, but it is, each of our staff members have been given the CDC sanitizing guidelines, and we follow that, and we make sure that that we are following those procedures at each of our communities, but through spot checks and oversight and other things.
Thank you.
Of course.
And that they have the proper cleaning supplies required.
Right, that's a good point as well, right? So we don't want, what we don't ever want is for a staff member to be making it up on their own, trying to, they're always going to try to do the right thing or do the best thing. But, if they don't have the proper sanitizing supplies, the proper wipes, the proper gloves, the proper, whatever your particular organization has deemed to be the proper PPE and sanitizing and disinfecting supplies, we don't want them to just make it up on their own. And, well, I thought I could just use Windex instead, or I thought I could use one of this product that I had at home. We want to make sure that we are supplying them with the proper cleaning products and PPE so that everybody's on the same page and using the same products. Any other questions? All right. Well, Mary, we're at about 38 minutes or 40-ish minutes, I think. So that's all we had to talk about. Again, if there are any comments, I'll kind of open it up to general comments, maybe some best practices. We got about 5 minutes left, or we could share some things if you're so inclined. And I'll open it up to the group.
One thing I did want to share in case it wasn't clear before, the company for the app is M Health Coach. If you're interested in that, that's where you can find that information.
All right.
When doing training with any of the chemicals, make sure that they have the data safety sheets so they know how to use that chemical.
Of course. So as it applies to our maintenance operations at any of our companies in general terms, right? Any chemical, cleaning solvent or whatnot that's being used obviously needs to be stored properly. MSHDA sheets need to be available, and it should all be spelled out in your hazard communication program. So all those sanitizing supplies should be included in that as well. All right. Well, if that's no other questions or concerns, I would like to take the opportunity to thank the group, thank Cinnaire, thank MSHDA for giving myself and Denise and Jennifer the opportunity to discuss this important topic as it relates to staff and resident safety in this kind of new era that we're in. And with that, I will say farewell.
Thanks, Matt. You guys did a great job on this. We appreciate it.